work at AAA Pediatrics, and I've been there since October of 2009. And okay, this is a little bit about us. We're located at 2200 Opus Boulevard, Suite 355 in Woodbridge, Virginia. Like Caroline said, we recently moved to this location in March of this year. We're located near the Centera Northern Virginia Medical Center, which is right in the street. We have Dr. Oscar Sagasti and Dr. Griselda Mesa. We have a staff of 6 people, and we have a total of 8 patients room. We were established in 1996, and Dr. Sagasti acquired the practice back in 2011. Our population consists of 80% of Medicaid, which includes our MCOs. We have a large community of self-pay patients due to our surrounding, and I also believe due to our accessibility of the prices. We also take most major private insurance, and we have a full bilingual staff. This includes our providers. We also educate we do externships such as for MAs and for NPs. This was our previous location, some of you know it. And let's see, this is how it used to be back then. We used to have paper charts. We would send out all labs. We would have low compliance rates because of this. We were referred out allergies. We had minimal access due to either transportation or an insurance issue. We had low dental care for patients under 2 years old and low immunization rates for our teens. There were no options for self-pay patients to do their labs, and there were minimal communication between clinic and patient. Everything was solely by telephone. This is our new location. We are actually located on suites 355 and 375, which, as you can see, is all 4 doors from left to right. And this is how it is now in the new location. We have electronic medical records. We have more in-house labs, which is more higher compliance. And we have an in-house allergy testing. A nurse that comes once a week. This is same-day treatment. We have in-house fluoride treatment and education. We have higher compliance with immunization for teens, and we are collaborating with Sunrise Labs. As you can see, there is some information about them right there in the folders. We also do triage in all of our rooms. So all of our 8 rooms are equipped with everything that we need to perform the triage right there in the room. We also have access to our patient portal, and we have social media communication. So our goal is compliance, convenience, and accessibility. By having more services in-house, we have created a higher compliance with our patients. It has been more convenient for our patients, less running around to different locations. Parents are more aware of the need of dental care for their babies, and we have provided an option for our self-pay patients to have their labs performed at an affordable rate. We also implemented a new way to triage. Like I mentioned, we do have all the equipment available in all of the rooms, so there's no need to have just one space for the triage. All of the rooms, they can be triage, we can use all of them at the same time. We have a side for our well-behaved babies, and then we have a side for the sick ones. And then we are also using, for the vision and hearing, our Welch-Allen Shore sites and Welch-Allen audio scope. This is very convenient, so it's portable, so we can take it to any room, so that we can do the vision and hearing right there in the rooms as well. We have created a flyer to promote ourselves. This includes all of our information, as much as I can fit in there, of all of our services, and a brief bio of our providers. This is to promote ourselves at OBGYN offices, so that the OBG can give this to the parents and be familiarized with our service and our our providers. In this flyer, I also included some of our social media, our QR code, and the Hilo app as well. We are currently using our website which is AAAPediatrics.com, which is very easy for the patients to remember. We have our app. This is completely separate from the Helo. This is our app that includes information from our website and our Facebook, which is one of our social medias, and we just recently started our Twitter as well. Obviously, we have our patient portal. We use it as much as we can. We take advantage of all of the information that is available there. This has helped a lot to communicate with patients so that they are able to, ask for refills, get their shot record. They don't have to be calling us so that we can get a copy of that. This also helps us with labs, referrals, prescriptions, anything that's pending. It also lets them know, we send out reminders and they're able to see their results. And I've noticed that the patients like that a lot, that they have the power to control what they, that they can see everything. For our teen immunizations, we are promoting obviously all of the immunizations, but the hardest ones are always the teenagers. We use all kinds of research to help us with this. We participate with this. This has been a great tool for us in our practice. We're able to look up records that in some occasions that we have no access to. Either the patient lost it or they just don't know how to get their shot records. So this has been helping us a lot with that. And we can also verify that we are giving the patient the correct vaccine, especially with those catch-up babies. We also use it for inventory. A great feature that's coming up with this is that since we are 80% Medicaid, we have a lot of VFC vaccines. And to order VFC vaccine it's quite some time, and it's a little hassle. So this is creating an option where we're going to be able to order our VFC vaccines through their website, so it will be much, much easier. We also send constant reminders using, like Clinical said, our campaigns. That's been helping us a lot. We use phone calls, texts, emails, anything that helps to get that parent's attention. Hey, you're due for a well-child visit. Your child is behind for shots. Come on in. I use our app, as how when you have an app and it reminds you or something. That has helped us a lot as well. And we also bundle our vaccines. And we specifically put it this way. We put Tdap, HPV, and MCV because HPV has always been an issue for some parents. And this way we give it an equal value to all vaccines. Another very important service that we provide is that all of our providers administer the vaccines, which is something that the parents really take in much better. We continue to educate our staff all the time with new vaccines, new information. The more confident our staff is about the vaccines, the more confident the patient or the parent is when they're getting their vaccines. We have availability and education for patients, like I mentioned, all the time. And because of all of this, we have increased our team compliance. So our in-house labs, this is our major change in our office. We are currently doing in our office hemoglobin, strep, urine analysis, lead. For the lab, we're collecting it, and then we're sending it out to get results. This is for self-pay patients. We are currently doing total cholesterol, HDL, cholesterol, and lipid panel pregnancy tests as well. And then we send out all our streps out for culture. This is to ensure treatment. Now, by having more in-house labs, it is more cost-effective for the patients and saves them also travel time. This is a brief training that, it was a brief. It was a training that we had from Alera when we acquired the Cholestech LDH. This is the machine that allows us to do the cholesterol checks and the lipid panels. Our self-pay labs. Well, with the collaboration of Sunrise Lab, we can now send our self-pay patients to get their lab work and give them the exact amount. This has been an issue before because we will send a self-pay patient to get their lab done, and they will always ask, how much is it going to be? And we had no idea how much the lab would be, depending on which lab they would go. So with Sunrise, they have given me, if you guys grab one of these, you can see the list of the labs with the exact price of each lab that you're sending the patient to. And what I have done is I integrated this same sheet that you see in here, and I put it into InClinical. It took me some time, but I had to do it because it would be easier for the providers, for the MAs, and for the patient to have all that information right there and then. Not only does it have the name of the lab, but it also has the price. So that when the provider's adding all of these labs, they can give them a total price. And this way the parent feels more confident when they go to the lab and they know already how much they're going to be charged. If you want more information about this, you can reach Randy. That's his phone number, and his card is also in the folder. They are also located in Maryland and in Virginia, and they have some locations also in DC. So it's not just in where we're located in Woodbridge. They have all over the place. So we also started our allergy program. This is a great new service for our patients. It's convenient, it's same-day treatment, same-day results. We've seen that the children, because we test from 2 to up, they're familiar with us. They come to us sometimes when they're sick, like every week or at least every year for their physical. So they're familiar with the location, with the staffs, with the providers. So it calms them down in order to perform this test, because it is a little bit time consuming. So that's pretty easy in that part with the patients. Now for more complex cases, the parent feels more confident when they go to the specialist, because they already have the test results of the allergies that we did in-house. And they can go straight to treatment. They don't have to do that extra visit, because when they go to the specialist, they have to pay a higher copay. So it's more cost effective for the parents as well. We also do the fluoride varnish for our babies. We're participating in Bright Smiles for Babies. This is a great benefit for a lot of our babies. The parents get early educations, and the babies start their treatment with their first tooth, and they can do it on the same visit as the physical. There's no need for a separate visit, a second drive to a practice. We can do it right there and then. This is especially very cost effective for parents that have minimal dental care coverage for their babies, and especially for our self-pay patients. We also do other services such as wart removal and medical ear piercing. This is a sterilized medical grade titanium. They are designed to avoid metal allergies and skin sensitivity. These are direct feedbacks from us. Since we're doing so many new stuff in our practice, I want to hear what the patients think of it, or get their feedback to see how we can improve it. I've gotten nothing but positive feedback from everybody. Everybody that says that it's convenient, they like that, my child was familiar with the staff. We had a patient that came for the allergy test for 2 children, and it took a while. So since they were very familiar with the practice, it was quite easy. We didn't hear that baby crying all the time. They were calm, and they were able to take the test. One parent told me, I have 4 children. For the teenagers, they had to do all the cholesterol check and all the other labs that we would send them out to, such as UA, the cholesterol, hemoglobin. We do everything in-house for the teenagers. So the mom was very pleased that we were able to do that all in one visit without her having to go to the lab and then come back for the results. We get the results right there and then. It takes only 5 minutes for the cholesterol, and they can hear the follow-up right there and then. So what's in the future for us? With all this new not stopping here. We're going more out. We want to provide even more technology base, more labs. We want to do full CBCs. Instead of sending out the lead, we want to be able to perform it right there and then so that we don't have to wait for the results. We want to do monospots. We want to do more for psychology, obesity, especially asthma care. We want to be able to do a one-stop shop. And we're going to get there. And then this is our full staff with our providers and our wonderful MAs.